Good morning, doctor and friends. We are from SGD B2 and today we are going to present our student project about risk factor for hepatitis B virus infection among pregnant women in East Lombok district. Next. So these are our member. Next. My name is Putri Tamia Desrianti with name 081. And for the background, hepatitis B is a threat to the world community nowadays. World Health Organization estimates that 257 million of the world population suffers from chronic hepatitis B. In pregnant women, hepatitis B can cause dangerous complications and at risk of being transmitted to their babies, which can occur during pregnancy, during and after delivery. Hepatitis B in Indonesia in 2017 reached 7.1%, and of them 2.7% were pregnant women. In 2016, the prevalence at West Nusa Tenggara reached 3.4%, East Lombok 3%, and at Pringgasela Health Center 3.4%. The importance of understanding the risk factor for hepatitis B to reduce transmission, so that prevention efforts can be carried out effectively. Research and data are still limited, so a study was carried out by Faisturami et al. About the risk factor for hepatitis B among pregnant women in East Lombok district to determine the association between hepatitis B infection in pregnant women with parity, history of miscarriage, maternal or husband working abroad, age of the first marriage, frequency of maternal or husband marriage, and history of injection.
Hello, my name is Jerry and my last student number is 094. So for our student project, the research question is, the first one, what is the determinant model of hepatitis B among pregnant women in East Lombok district? Number 2, how is the natural history of hepatitis B among pregnant women in East Lombok district? 3, what is the correlation of hepatitis B among pregnant women in East Lombok district to occupational disease? Number 4, how is the calculation and interpretation for hepatitis B among pregnant women in East Lombok district? 5. What is the research design for hepatitis B among pregnant women in East Lombok district? 6. What is the data analysis of hepatitis B among pregnant women in East Lombok district? Number 7. What is the source of bias in research for hepatitis B among pregnant women in East Lombok district? Number 8. What is the possible surveillance system for hepatitis B among pregnant women in East Lombok district? Number 9 is what is the appropriate screening method for hepatitis B among pregnant women in East Lombok district? And the last one is, what is the relevance of hepatitis B among pregnant women in East Lombok district research to disease prevention and control efforts in community? Next slide. For the purposes in our student project, the first one is to discuss and analyze about hepatitis B among pregnant women in East Lombok district based on validated scientific sources. And the second one is to reach further understanding about hepatitis B among pregnant women in East Lombok district. And the benefits, the first one as a scientific basis for future research and development about hepatitis B among pregnant women in East Lombok district. And the second one is to enrich knowledge about hepatitis B among pregnant women in East Lombok district.
Doctors and friends, my name is Anagong Aifidia Penyandari with student number 232. In association with the determinant of the disease, hepatitis B infection use triangle model of determinant for easier identification purpose. The host factors that important plays a key role here are related to family history and gender. The natural history of this disease occurs when there is an influence of specific virological factors. Some of them are genotypes and also viral mutations. The level of hepatitis B DNA, one of the important agents inducing this disease, has become a good predictor for cirrhosis disease. The environmental factors that influence here are co-infection with another hepatitis viruses, such as hepatitis C virus and hepatitis D virus, and also human immunodeficiency virus, and also liver toxins, infection agents exposure like aflatoxin, which carcinogens that may contribute on the development of cirrhosis. In patients with hepatitis B, also included in environmental factor for hepatitis B virus. Thank you.
So hello everybody, my name is Lalita Samalo with student 156 and I tell you about the natural history of hepatitis B. Hepatitis B is spread by the virus being passed in a variety of ways from infected to non-immune individual. This transmission can be classified as two groups, which is horizontal and vertical transmission. The example for horizontal transmission is sexual intercourse, whereas vertical transmission example is perinatal viral transmission from the mother to the infant. There are some groups at high risk for HPV infection, include living with hepatitis B patients, having sex with an individual who has hepatitis B, babies born to hepatitis B infected mother, people who share needles, and etc. Typically, the HPV infection takes 30 to 180 days to incubate. Patients with HPV infection may not experience any symptoms at first or at all. It will depend on the specific virus genotype. Patient will feel serum sickness-like syndrome such as skin rash, fever, arthritis, and arthralgia. Other than that, patient may also exhibit symptoms like fatigue, nausea, anorexia, and abdominal pain. In immunocompetent patient, HPV infection can be resolved spontaneously until they cured through symptomatic treatment. Within 30 to 60 days of infection, the virus can survive and cause chronic hepatitis B, especially if it's spread during infancy or childhood. A patient with chronic hepatitis B is more likely to develop cirrhosis, decompensated cirrhosis, and hepatocellular cancer. An urgent liver transplant evaluation is necessary for fulminant liver failure brought on by HPV infection. Next. So here you go, you can see the natural history of chronic hepatitis B virus infections. Patients with chronic HPV infection can experience these four phases, from immune tolerant phase, immune active chronic HPV, inactive HBs AG phase to risk of reactivation. And in this figure, you can see what's happening in each phase. Thank you.
My name is Putu Arya Radi Bramantia with student number 181. And I'm going to explain about are the disease or cases in this journal related to occupational disease. Occupational disease are broadly defined as disease with specific clinical diagnosis associated with work-related factors. The worldwide burden of work-related disease and injuries is high, although there are large variations in and between countries. A work-related disease is any health condition partly or primarily due to exposure to risk factor arising from work activity. In principle, work-related disease can be prevented by means of timely control measures at work sites. Hepatitis B is a chronic infectious disease that represents one of the major global public health problems. Risk of infections is also ubiquitous in everyday life through blood transfusions or intimate contact with HBV carriers. As a result, everyone might become infected both at and outside work. The article we are discussing stated that the risk factor for hepatitis B in pregnant women mainly because their husbands who have worked abroad, the age of first marriage at 19 or younger, and the frequency of husband's marriage more than one time. Therefore, it is clear that this journal is related to occupational disease.
Hello, my name is Wilson Olim, student number 149, and I'll represent about the number and size mentioned in the article. Numbers can be divided into two, absolute numbers and relative numbers. The absolute number is the original number of the reference subject, while the relative numbers are numbers that represent a reference without giving exact figures. Example of absolute number can be seen on the screen, where number 52 and 104 are the original numbers in the field. Compared to the relative number are usually used to describe prevalence and ratios in terms of proportions. In the article, there are three tables, with each explanation as follows. First, table 1, distribution of cases and controls by age and domicile. This table gives the number of cases and frequency of controls and p-values. The number of numbers obtained come from number of samples used for research, which have been divided based on their distribution according to the variable used. Next, second, table 2, growth out ratio risk factor for hepatitis B infection in pregnant women. Growth rate itself can be interpreted as a count of the number of events divided by the total population selected and multiplied by a constant multiple of them. Calculation of growth out ratio can use the formula number of events or count divided by population meteors, then multiplied by constants. Third, Table 3 adjusted for risk factor for hepatitis B infection in pregnant women. The adjusted odds ratio value is calculated to find a number that can be used as a comparison against other population. In the calculation of the adjusted number, the standard population is used as a denominator to calculate the rate. The associated formula is the number of events or counts divided by standard population that multiplied by 100. Thank you.
Hello everyone, my name is Dani Prema, with the lesson number is 182. So next I want to explain about the study design in this article. So the sample technique used in this study was systematic random sampling, where the systematic random sampling is the right sampling technique in this study, because the sampling is systematic and easier to do when research on cases and control is carried out in the field. Where we can see the data collection in this study is by interviews with questionnaires at the respondent's house. However, the weakness of the sampling technique is that it depends on the length of the period and the sampling interval. The research design chosen was multivariate analysis with logistic regressions. This research design is used to predict the relationship between the dependent and independent variables. This research design calculates the probability of something happening depending on several variables. With categorical research data, the use of logistic regressions can determine the odds ratio contained in each risk factor. So that's all about the study design in this article. Thank you.
Good morning, data and friends. My name is Emilanawati Santoso, number W07. I will present about the appropriate data analysis and presentation of the data used in this journal. So to make appropriate data analysis, we should know the assumptions and conditions of statistical method. There are two main statistical methods that we are currently use are descriptive and inferential methods. And based on this journal, they use inferential methods to get relationships among the variables and using statistical tests. And this journal, for categorical data, they use logistic regression to determine odds ratio of each risk factor. And the presentation data of this journal is appropriate because they arrange the data from distribution by age and the measles and the adjusted risk factor for hepatitis B among the pregnant woman. And the data is collected with questionnaire that consists of three sections, which are characteristics of the respondent, the possibility of sexual contact, and the possibility of blood contact. And for methods of sampling, the journal used systematic random sampling from 67 pregnant women with HBsAg positive, and controls are selected with the same way from 1644 pregnant women with HBsAg negative. Thank you.
My name is Cynthia Sarsunana with lesson number 23. I'll be presenting the biases in this journal. In the questionnaire that was distributed, there were some sensitive questions such as the possibility of sexual contact and blood contact with people who have a history of hepatitis B. And due to the sensitive nature of the questions, it is possible that interviewee won't give answers that are grounded on facts. There are also a possibility that interview-based results can also give false positive results. Interviewers' expectations can indirectly affect the interviewer's answer, so that when the question is given, the interviewee will answer according to the interviewer's belief, thus affecting the results. Additionally, participants in this study who had positive HBsAg results performed the HBsAg examination procedure after conceiving. Therefore, it could create biases when searching for the risk factor for pregnant women in contracting hepatitis B. Thank you.
Hello, my name is Christopher William Luinata, student number 153, and now I will explain the surveillance systems that can be implemented or have been implemented in hepatitis B. Screening for HPV infection should take place during early prenatal visit for all pregnancies. A pregnant woman is diagnosed as HPV positive with HPV DNA level of more than 200,000 IU per mil, which must be administered antiviral therapy during 28 to 32 weeks of gestation. Infants who are born to infected women should receive hepatitis B immunoglobulin and hepatitis B vaccine as immunoprophylaxis at their time of their birth. Post-vaccination serologic testing, or PVST, also helps identify the need for revaccination. Aside from that, rate of progression, prevalence of infection, as well as transmission rates are also documented for future use. Surveillance of HPV in pregnant women and newly born infants is a very crucial step in preventing HPV transmission. Data are mainly used to monitor HPV incidence and prevalence, where changes in the number are actively tracked to implement quality measures and regimen adherence. Surveillance data are also used to monitor and evaluate the effectiveness of PHBPP as they contain key indicators which show comprehensive epidemiologic data on pregnant women, exposed infants, and infants who receive PVSD.
Hello everyone, my name is Mara Humeriantizam with your number 061. I'm going to explain about the screening for hepatitis B infection. There are several ways to detect hepatitis B virus infection, and they include history taking such as interview or anamnesis regarding the symptoms, physical examination to look for signs like jaundice, abdominal pain, nausea, vomiting, and etc., laboratory evaluation such as complete blood count, ALT and AST levels, and the testing of the bilirubin levels. And the diagnostic tool is serology testing. Next slide. Serology testing can indicate whether a person has been infected with HBV or not by identifying the three antigens. The first one is hepatitis B surface antigens, or HBsAg, and then hepatitis B surface antibody, or anti-HBs, hepatitis B core antibody, or anti-HBc. Each presence of these antigens indicate the state of the infection, as you can see on the table. HBsAg determines if a person currently has the infection. Meanwhile, positive anti-HBs means an individual has been cleared off from the virus after an infection or has been vaccinated for hepatitis B virus, meaning they're immune to HBV infection. And anti-HBc identify whether a person has been infected, but it doesn't provide any protection against the virus. Next.
My name is Christopher Yongasa, student number 172. Next is discuss what is the relevance of this journal to disease prevention and control effort in the community. This journal is relevant because this journal provides various information for the prevention and control of hepatitis B transmission in pregnant women, such as knowledge of risk factors such as young marriage and husband who have worked abroad, then education like the risk of multiple sexual partner, the use of condoms, and the risk of early marriage. And then the last is vaccination.
My name is Nikada Anggita Dewi, student number 033. So the next is conclusion. Hepatitis B virus infection is one of the health problems with big cases of morbidity and mortality. The natural history of this disease occurs when there is an influence of specific virological factors, environmental factor, and host factor. The risk factor for hepatitis B in pregnant women mainly because of their husband who have worked abroad, the age of first marriage at 19 years or younger, and the frequency of husband's marriage more than one time. The sampling technique used in this article, such as systematic random sampling, and it is direct sampling technique because the sampling is systematic and easier to do when research on cases and controls is carried out in the field. The limitation to this study is the inclusion criteria included SVHAG status, which was checked when the woman was pregnant, but the incidence of hepatitis B infection was unknown, so there's a possibility that respondents were infected with hepatitis B before conducting the study, and which could be used as one of the exclusion criteria. Next. The data analysis of the journal used inferential methods to get relationship among the variables and using statistical tests, and use logistic regression for categorical data to determine the odds ratio of each risk factor. Presentation data is appropriate because they arrange the data from distribution by age and domicile and until adjusted risk factor for hepatitis B infection among pregnant women. One of the bias that occurs in interview-based research is at the time of sampling, or when the interviewee are asked questions by interviewer, and it is possible that interviewee won't give answers that are grounded on facts. So that's all about the presentation of SGD B2. Thank you so much for the attention.